Hello, good evening, everyone, and thank you for joining us for another digital Infoday session. My name is Hannah. I am the Healthcare Professional Senior Projects Officer at Myeloma UK. I manage our Myeloma Academy site that hosts learning modules and resources for a range of healthcare professionals. Before we begin our event this evening, I would just like to go over some housekeeping. I'd like to let everyone know that this session is being recorded and will be available to watch on our Facebook page and our website soon after. We will be popping website links, publications, and useful information into the chat box throughout this event. If you do have any questions that you would like to ask our experts, please use the Q&A box at the bottom or top of your screen, and we'll try to answer these at the end of the session. Some of you might not be that familiar with our organisation, so I'd like to tell you briefly who we are and what we do. Myeloma UK exists to support all those affected by myeloma and its related conditions, which include smouldering myeloma, MGUS, and AL amyloidosis. We are patient-focused and aim to empower, inform, and support patients in everything we do. As an organisation, we rely on the generosity and kindness of supporters who fundraise and donate. Myeloma UK is a charity solely funded by our supporters. We receive no funding at all from the NHS or the government, so everything we do is funded by voluntary contributions, fundraising, and gifts left in wills. We are truly thankful for all your contributions as they allow us to continue working to help patients, their families, and their friends, and put on events just like this one. Tonight's digital event is titled Survivorship, a topic that is becoming more and more important with advances in treatment allowing patients to live longer with myeloma. And today we'll be focusing on the psychological impact this can have. Let's get started. I'd like to welcome this evening's experts. Unfortunately, Audrey Robb is not able to be with us tonight due to a family emergency, but we are pleased to welcome Silver. Is one of our myeloma information specialists who works on the myeloma info line and Ask the Nurse email service. And Surabu Chaturvedi is a psychotherapist. It's really nice to have you both this evening. I'll hand over to you to begin.
Thank you, Hannah. Hello, thank you for that introduction. My name's I'm one of the myeloma information specialists. So we're going to talk about survivorship. So this talk will cover a brief overview of myeloma and how survivorship has improved, potential challenges that people might face as a result of that, and how myeloma can affect people physically in the longer term. So we've got 3 take-home messages from my talk. So people with myeloma are living much longer thanks to a greater number of better and more effective treatments. Living longer with myeloma can cause longer-term physical effects that can be managed with support, and different challenges can arise and can change over time. So just starting off with some key facts. So there's approximately 5,900 people diagnosed with myeloma each year, and around 25,000 people living with myeloma in the UK. Myeloma is a rarer cancer. It counts for 15% of blood cancers and 2% of cancers generally. And it does tend to affect people over the age of 65, but has been diagnosed in people much younger than that as well. So people with myeloma are living longer than ever. That's what this talk is about. Half of all myeloma patients will survive their disease for 5 years or more, and around a third will survive their disease for 10 years or more. So 5-year survival for myeloma patients actually doubled since the 1990s, and 10-year survival has tripled since the 1990s, and the average life expectancy has quadrupled since the 1990s. So in the last 30 years, we've seen a massive change and a huge increase in survivorship for patients with myeloma. So the increase in survivorship can, however, bring challenges, and these can change over time throughout the course of myeloma. Ongoing symptoms and complications, which can affect not only the quality of life, but also how you live your life. Long-term treatments, so taking these daily, as opposed to the sort of more cycle-based, old-fashioned chemotherapy treatments. This can be very different for patients and can be quite burdensome. Side effects to these treatments, which can be changing with time and with different types of treatment. Ongoing monitoring and testing, which might mean that patients need to take time out of their lives to attend appointments and get to hospital. Relapses, so not only the physical difficulty of a relapse, but the uncertainty of when that might come, and sort of the stress around that. Comorbidities, patients living longer, developing other conditions that they have to manage alongside their cancer. And then also the changes in treatment options. So there being some uncertainty, not necessarily being able to access treatments, and having to choose between different options, such as entering clinical trials and things, which can add stress to patients' lives. So myeloma can have multiple effects on the body. So here's some of the sort of common ones. So fatigue is a very, very common problem that people with myeloma face, and something we get calls about on the info line quite frequently. It can be very debilitating and can be caused by myeloma and treatments as well. Patients can get recurrent infections, which can have short-term effects, but also can have more long-term effects on the body as well, and can change the way you have to live your life to avoid further infections. Pain is incredibly common, and if it isn't properly managed, then it can reduce your quality of life. It can be caused by many things in myeloma, and can also sort of increase the amount of treatments you're required to take, which again can be burdensome and cause more side effects. People can have easily broken bones due to myeloma bone disease, which can be very painful and cause disability, but also might change the way that you live your life and mean that you have to give up hobbies that you previously enjoyed. And then myeloma kidney disease, which is another common problem within myeloma, and that can have to change the way that you live your life based on managing your kidney disease, having fluid restrictions or starting dialysis. Can also have a lot of symptoms as well that can affect people's lives quite significantly. So myeloma is a relapsing and remitting cancer. So that means that there are periods of where the cancer is less active and is under control, and periods where the cancer is more active and will require treatments. Living longer can mean that patients are more likely to go through more relapses, and they tend to be shorter each time a relapse comes. Remissions, sorry, are shorter and tend to be short. And that can be quite challenging as well. There's a lot of uncertainty with when relapses can occur, and so that has quite a large psychological impact, which Surabhi will be talking about in her talk later. So treatment options can sort of change throughout the course of myeloma. So being refractory to a treatment means that the treatment hasn't worked, or that it has stopped working sort of after it has been working for a while. This can become more common after later lines of treatment, and can also have a big psychological impact on patients. Also, being refractory to a treatment means that you may not be able to have it again, and therefore that can reduce the number of treatments that are available to you at later lines, and again is another impact of this longer survivorship. So because of all of this, looking after mental well-being with survivorship is vital. So we've got some quotes here from some patients who have talked a little bit about it. So the support I need now is different. I know it'll come back, and that's a different type of mental load. Help to process and understand that would be good. And the challenge is dealing with uncertainty, and how you cope with that is very individual. I am a positive person, and that helps. So just a little wrap up of what we've covered. So a brief overview of myeloma and survivorship, some potential challenges that people might face with myeloma, and how myeloma can affect you physically in the longer term. And there's the take-home messages. Thank you very much for listening.
Thank you so much, Em. I think it's really useful to understand what living longer might look like for people, and really encouraging to hear how survival rates have improved. I'll now hand over to Surabhi to talk more detail about the psychological issues around people living longer with myeloma. Surabhi, over to you.
Thanks very much. Hi, everyone who's logged on to listen. Thank you for being here, and thanks to Myeloma UK for inviting me to be part of this session. I'm Surabhi, and I'm the lead psychotherapist for hematology at King's College Hospital. My team supports patients with a diagnosis of any type of hematological cancer, including myeloma, from any point diagnosis onwards. And we also support family members and informal caregivers who are being supported by our hematology department. So survivorship in the context of myeloma is, of course, different to many other cancers due to the fact, as highlighted by Em, that although treatments for myeloma are improving constantly, currently myeloma patients have to prepare themselves for the fact that the disease will return at some point. Living well with myeloma will mean and look very different to different people. I'm very conscious that people might be listening in at very different stages in their disease pathway. And myeloma survivors, your lives might look very different from each other's as well. So I've offered very general advice and suggestions because of the diversity of people who might be listening. And I don't want to be too rigid or prescriptive around what one should do psychologically to help oneself. So I guess my advice always to people at webinars like this is to take what you find helpful and leave what isn't. The expectation isn't that you should follow all these suggestions that are being offered. And as you'll hopefully see, a lot of what I'm going to touch on is about living with and tolerating uncertainty. Before we move on, I want to invite everyone who's listening to just have in the back of your minds that ultimately it's about recognizing the fact that you'll all have different priorities, different things that matter to you. And you'll have to ask yourselves the question of what's important to you in your day-to-day lives and what do you want to invest your time and energy in. There isn't an idealistic right answer to this question. Some people might want to live life very differently after a cancer diagnosis, and some people might want to or need to return to as close a version of life that they were living before, between treatments or alongside treatments. And so it's about recognizing that having some sense of purpose of why we are going through treatments and why we want to survive, what do we want to have the time and energy for, can really bring that richness and that connection to something meaningful in the whole experience of survivorship. The road to myeloma survivorship and on myeloma survivorship can, of course, be of an indefinite length of time. And on this road, many emotions are likely to be present. There can be relief and there can be joy and there can be gratitude, but there can also be frustration and stress and worry and fear and low mood, sadness, grief, loss. So, I mean, I draw your attention to this sort of up and down roller coaster diagram on the slide there. And although this is a metaphor that patients often use to describe the experience of having a chronic condition or having myeloma indeed, it's about recognizing that acceptance of illness is not a neat process. It doesn't just go in a linear fashion. It's quite messy. It's quite complicated. It's full of ups and downs. And it includes recurring moments of loss and sadness that might hit you in waves, even though you find your feet and you might be quite optimistic and living quite a good quality life. So it's about really looking at adjustment in the context of survivorship in myeloma as something that is full of ups and downs rather than quite neat and, neatly packaged. So I think coping with any kind of loss or chronic sorrow, which is what living with a chronic health condition can feel like, that we have an awareness might shorten our life or the life of our loved one, can involve oscillating between confronting the loss and moving forward. So on the screen is what's in the world of psychology is called a dual process model of grief. And although it was developed for grief after a bereavement, it also applies, I think, to other types of losses, which come inevitably when one has a cancer diagnosis and is living with a chronic type of cancer. So when living with myeloma, you might have moments when you're much more in touch with what the disease has resulted in costing you, the things you've had to give up, the things that you've lost, the changes you've had to accept and deal with. And there might be other moments when you're able to distract yourself or you're able to engage in a meaningful activity, and for a brief moment, even forget the fact that you have this condition. So it's quite normal to oscillate between a loss-oriented focus and a restoration and forward-looking focus when it comes to living with this in a long term. Oh, if we could, I think we may have jumped. Have we jumped one slide, Hannah? Could you move forward? I mean, perhaps. Sorry. If you just move on, I think the order of the slides is. So if you move one slide forward. Sorry about that, everyone. So I think I just wanted to start by laying out what, in my experience, has been some of the key challenges that I've seen patients with myeloma struggle with over the years. And I think they fall into three broad categories. One is frustrations and limitations caused by ongoing side effects. Many of these are likely to be much more present, of course, when you're experiencing a poor physical quality of life due to treatments and you're not able to fulfill all your roles that are important to you, or you're not able to achieve all your wishes and goals in life. The second is the biggest one, I think, is around uncertainty of the terrain and the timing of the disease coming back. And the biggest reason this is difficult is because it makes it difficult to plan long-term changes like moving home or moving neighborhoods if you're looking for better schools for your kids, whether to return to work or whether to invest in kind of more recreational activities and live life to the fullest. As human beings, we crave certainty, and we crave certainty because we want to know that the decisions we're making are the right ones. And often for myeloma patients, because the threat of relapse is always there, this can feel very difficult without knowing when it might happen. And then the last one is around having to build yourself back up to your baseline following each cycle of treatment. And this includes not just the physical recovery, which can impact people differently, but also in terms of building up your confidence and your self-esteem, which can take a little bit of a hit if treatments really impair you significantly. Sorry, I'm going to ask you to go back one slide first. That's great. Thank you. So I'm just going to touch on some psychological tools and perspectives that can help with the types of challenges I've described. The first is something I like to call compassionate reasoning. And it's essentially recognizing, the compassion part is about recognizing your humanity and recognizing that your suffering is valid, and to look and hold that with kindness and with love for yourself. And the reasoning part is to access that problem-solving, resilient part of you that helps you get on with day-to-day life or has helped you cope with adversity or problems in the past. So it's about striking this balance between holding your own self with what we like to call loving kindness in compassion-focused therapies, but also trying to remember that you are a resilient person. I think everybody who reaches a certain stage of life, you don't get there without being good at problem solving, because it's such an essential skill that we need just to get on with being a human being in a world that is unpredictable and where things happen and people and situations impact us that we didn't expect. Thanks very much. And the second part of that, building on from that, is around checking and softening our beliefs. So we all hold certain assumptions, we interpret the world in certain ways, and we have certain beliefs about it. And our beliefs might underpin our emotional reactions, even when we're not consciously aware of holding them. So becoming aware of what's the underlying assumption that's driving my stress or my anxiety can be a helpful starting point. So, for example, some of the types of beliefs that might underlie distress about a health condition are: I need to know in order to cope, I need to plan, I need to be in control in order for things to be okay, or I can't be okay when I have no control, and I have to make the right decision. But I invite everyone to just take a moment and think about whether these statements are actually exactly true in that form. And can you think back to a time in your life, even before the myeloma diagnosis affected you, when you didn't know something was going to happen and you found your feet and you had to deal with it once it happened? So what we can do with these beliefs is we can try and just take the sharper edges off of them and just make them a little bit more well-rounded and reframe them slightly into gentler versions that can help us be with uncertainty a little bit better. What I mean by that is, for example, as it says on the left-hand side, I need to know in order to cope. You might try thinking, I don't like not knowing, and not knowing is uncomfortable, but I can try and work with what I know so far. And that's the best I can do. Similarly, there are other examples on the slide that I'll leave you to read, but it's essentially about changing the need to have to into I'd like to, but however, this is what I have to accept and live with. So instead of focusing on obtaining certainty and controlling things, focus on your ability to adapt to changes and try and boost your perception of that. Like I mentioned earlier, when things are going well for us in life as human beings, we fall into the illusion of thinking that we are in control. But there are times in every human being's life, whatever your age, whatever your circumstances, when things happen that are unpredictable, that catch you by surprise, and where you have to adapt in the moment. And thinking back to those times and remembering that you have this inherent resilience that allows you to problem solve situations can help when the time comes, and even if it doesn't feel good. So the idea is uncertainty doesn't have to feel good. We just have to know that we can tolerate it. So it's about being okay even when we don't know all the answers, because we believe in our ability to find them when the time comes. The second approach is to try to problem solve where the situation allows for this. What I mean by this is some examples of the types of problems your mind might struggle with in the face of uncertainty might be, I don't know what the future holds. I don't know how long my life will be. I don't know how long my remission will last. I don't know when I might need treatment again. I don't know how my body will tolerate more treatment. I don't know whether to spend my time working or just being with my family. So our minds can time travel. They're very good at time traveling, actually, but we can only influence events in the present. The further into the future we look, the more we can lose that sense of what we know and what we can be sure of. And when it comes to decisions about what to do, remember that the pressure to feel the right decision is quite instinctive, but try to soften it, given the reality of having quite limited knowledge and the reality that nobody has a crystal ball that can show us what lies ahead. When it comes to big questions about what could happen, try asking yourself, is there something about this that I can prepare now or tomorrow or next week? If you can think about things you can do in the present to prepare for the future uncertainty that's feeling scary, that's good, and you should try to look to putting them into action at the earliest opportunity. For example, if you've got people who are dependent on you, or you've got young children and you want to kind of safeguard their future, and if there's something you can do now in order to get one step closer to that, that's a good way of dealing with that uncertainty. It might be that sometimes doing this type of forward planning can bring up painful feelings for us because it means confronting kind of like the worst case scenario when we're thinking about planning, having discussions about wills and making plans for the care of people dependent on us. It can be a painful process, but actually some people find that doing it offers a lot of relief because it feels like you've taken some control into a situation that feels uncertain and scary. But there might be times when the answer to that question of whether you can do something now is a no. And it wouldn't, that if asking yourself this question won't make you act differently in the present, then that's a sign that maybe it's about compassionately putting that question to one side by telling yourself, we just have to wait and see. Now, it's really important to try and tell this to yourself in a soothing and compassionate voice, because our nervous systems respond to compassion in a way that we don't often realize. And talking to ourselves or as some patients put it to me, having a word with yourself, but not in an angry or judgmental tone, but in a really kind and soft tone, can soothe that feeling of anxiety that you're having. The other thing that happens when we're feeling stressed or anxious is we can start to experience emotions associated with a future event, or not even a future event, a future possibility, as if it's already happening. To put it differently, we live something mentally and emotionally before we actually need to live it experientially. For example, if the uncertainty of what life will be like 6 months from now stops you from making any plans while you're actually feeling quite well, that's an example of that. Or the idea of going into hospital on Monday, Tuesday, and Thursday next week makes you feel really kind of run down and frustrated at the weekend. That's an example of where a future experience is actually coming in and ruining your present moment. So it's helpful to sort of remind yourself that that's not happening yet. It's not happening today, and that can bring the focus back into the present and help you be more fully present in if there are pockets of rest between the frustrating aspects in your survivorship journey, then it can make you experience those pockets a little bit more, rather than it feeling like you're just living from one stressful event to the next. Similarly, sometimes we experience worry as the mind asking a lot of what-if questions. But what happens is we don't often try and generate an answer. So the mind can go into a little bit of a spiral, saying, what if something goes wrong? What if I can't get there in time? What if my treatment doesn't work? What if I have to have different treatment? What if the treatment doesn't suit me? What if my body can't take it? So it generates a lot of these questions. What if, what if, what if? What can be really helpful is to kind of pause, take a deep breath, and try and answer the question, right? What if I can't make it to the hospital in time? What would you do? I'm sure there have been situations in your life when your day didn't go as you hoped it would. And yet here you are, finding your feet and trying to do the best you can. So it's about really remembering that we can generate the answer if we just try to do that. And the next bit is, of course, about understanding and accepting our emotions. Now, this might seem like really simple advice, but it's really quite impactful when we allow ourselves to truly feel a range of different feelings. In my experience, a lot of the distress people feel comes from the self-criticism they show themselves about having a particular feeling. So on one side, this means recognizing and showing compassion for yourself when you have low moments or in touch with the costs of the disease and the treatments. And on the other hand, it's about having an understanding about how stress and anxiety affect your thinking, affect your appraisal of the situation, or your ability to problem solve. When we are more in the grip of low mood or stress or anxiety, we are much more likely to make negative appraisals than when we're in a neutral or positive emotional state. We're also not only that, we almost develop this tunnel vision where our mind notices threat-based information and amplifies it much more than if we're in a neutral emotional state. So knowing this, that there's this attentional bias when we're having low mood, stress, or anxiety can help us take a step back and ask ourselves, is there an alternative way to look at this? Is there something I'm disregarding or minimizing? Because I know that when I'm stressed, I tend to focus on the negative. So simply knowing that can make us take a step back from being in the grip of that, whatever that unhelpful thought or stressful thought or worry is. The next point I want to touch on is something about connecting to our values. Now, values in this context is nothing to do with morality or doing the right thing. Values in this context refers to just personal qualities that I want to live by. You know, how do I want to be known? What kind of small personal qualities do I want to be associated with? Examples of values could be things like being kind, being loving to our families, being curious, being adventurous, finding the lighter side of things, or being a kind of champion for fairness and justice. These are things that can be described as values. And we express these values through really small ongoing action. And finding a connection to our values can give us direction when we're not sure about the bigger goal or the outcome. And living according to our values, even when we're not sure whether we're going to be able to achieve everything we want to achieve, can give us a sense of meaning and richness and living a fulfilled life. One way to connect with values is to ask yourself, you know, if I leave the room, how do I want the people closest to me to describe me? Right? How do I want people to talk about me when I'm not there? That's a really good way to identify what's really important to you, what values matter to you, and then identify, okay, what small ways are there for me to express these values? And then I want to move on to something about basic self-care strategies, which is about an ongoing commitment. It's not just about, you know, for a lot of people, self-care means doing something like going to a spa or, I don't know, having a warm bath or treating yourself to something. And that's certainly a part of it. But the kind of self-care I'm talking about is more an ongoing commitment to better look after your needs. And I mean that at every level. So one is taking care of our physical health, by which I mean things like good rest or good sleep. And I'll also emphasize here that sleep is not in our control, but rest is. Mild to moderate exercise when you're able to do it. Just simply being outdoors when the weather allows it, obviously. And eating and drinking as well as we can. These things go a long way because ultimately we're embodied beings. We live inside our bodies. And taking these measures to look after our physical health can be really helpful. I'd also suggest to people to learn some simple relaxation techniques. Now, relaxation techniques can include breathing exercises. One simple one is to breathe in for a count of 4 and breathe out for a count of 8. That's a really simple one where you just exhale slower than you inhale and you take a breath and really try and pay attention to the sound and the quality of your breath. Because it means that if we have a couple of these strategies we can use, we have something accessible to us that we can use when we recognize we're feeling overwhelmed. There's no list of symptoms for which these are good. These are good at any moment when you're feeling emotionally overwhelmed, whether it's because of low mood or whether it's because of high anxiety or high stress or fear. Just having a few relaxation techniques that work for you can help. And there are loads of apps that are out there now that have very simple breathing exercises that people can follow. The other thing that can help is there's an acronym from the world of cognitive behavior therapy called ACE, And that stands for achievement, connection, and enjoyment. Because there's an idea that we all need a little bit of these in our lives in order to keep our mood from staying persistently low. Now, notice I said persistently low. It's part of being a human being to sometimes have low mood, but having a balance of achievement, connection, and enjoyment stops us from going into what we might describe as a depression. So my advice would be do a quick check of your diary. Try and recall moments that brought you any of these things. And look for the small stuff, not the big stuff. The big stuff might be easier to notice, but the small stuff is the stuff that makes the difference. So acknowledge the smallest wins or the briefest moments of social contact. If you were able to do something today that you weren't able to do a month ago, that's a win in the achievement column. If you saw a friend or are getting ready to socialize a bit more when you couldn't last week, that's a win in the connection column. If you were withdrawn last week and didn't feel like talking to anyone, but this week you sent just one text message to somebody close to you saying, hi, it would be good to have a chat, or how are things going with you, then that's a win in the connection column. So it's really about noticing the smallest steps you can take in order to give yourself achievement, connection, or enjoyment, and kind of acting on those. The last thing I want to touch on before we finish is, everyone is different in terms of how much they want to confront next steps, disease relapse, or the worst case scenario, or the end of life. And there's no one right way to do this. People lie on a spectrum ranging from, I'm not going to think about that till it happens, to there are some people who want to be fully prepared. And there's honestly really no right or wrong way to approach this. And many of you might find that you're at a different place on a different day. So you don't have to pick one spot on the spectrum and stick to that. You might be somewhere in the middle, and at a different time, you might find yourself approaching this differently. I guess what I would advise people listening is to ask yourself some questions to try and establish what it is you need in relation to this idea of preparing for or confronting recurrence of disease. You could try asking yourself, what's going to help me in the here and now? What do I need? Is it more information I'm seeking from my team about what happens next? Or is it that I need to remind myself that whatever it is, I'll cross that bridge when it comes to it, and I have people around me who will help me? Is there something I need to do to prepare myself for the recurrence of myeloma? So asking ourselves these questions, being curious about our own experience, can help us better understand what it is we need from any given situation. Sometimes it will be answers from your team. Sometimes you'll want to know, okay, when the disease comes back, what's the plan? Sometimes you'll just need to remind yourself that I don't actually need to know that answer right now. Right now, I just want to live my life as best as I can, and I'll deal with it when it happens. I think that's the end of my presentation. Thanks everyone for listening. And I think I'll be glad to answer any questions.
Thank you, Surabhi. That was a really interesting talk. Yeah, I think particularly the way that you described the journey of survivorship sort of has been oscillating or in waves, that you will have periods of change in emotion, and that is okay. So thank you for that. We are now going to take some audience questions. Thank you to all of those who have submitted questions in advance. We really appreciate your honesty in talking about this, because it's, there are some difficult situations you may be experiencing, and we hope that we can offer some support and information today. And if not, of course, you can get in touch after the webinar. So if you would like to submit any more questions, then please do feel free to in the Q&A box, and we'll try our best to get through as many as possible. So if it's okay, Surabhi, I'll start with a question for you. Please do feel free to chip in if you like. But this one's from Arlene, and it says, how do I cope with the subtle and larger changes in lifestyle that this condition brings, especially the conscious uncertainty?
Yeah, I mean, thanks, Arlene, for this. I think I like the phrasing of the subtle and larger changes in lifestyle, because it can be that way. I hope some of the things I covered in the talk have helped address that topic of how do you tolerate uncertainty. I think ultimately uncertainty is about recognizing that you live only in the now. And so the mind, uncertainty and anxiety about it comes because the mind is time traveling. The mind wants to know what's going to happen next. Asking ourselves, what do I need to know to get through today in the best version of myself that I can really bring that focus back to something that we know and can look ahead to. So that would be my one bit of advice in addition to what I covered in the talk, which hopefully helps. It is one of the most difficult things as human beings to tolerate uncertainty. And actually, sorry, just one more thought I've had, Hannah, is around, I think it's also about telling yourself that uncertainty feels uncomfortable, but you don't have to fix it. That this feels uncomfortable because I don't like it, but I don't have to make this feeling go away. I can find other ways of being with this slightly uncomfortable feeling of not knowing the answer. And that's where the breathing techniques and other distraction techniques comes into it.
Thank you, Swabi. Yeah, I think that's great advice. I think this is another one that you've maybe covered in your talk, but just in case you have anything else. So this is sort of a question and a comment. So I have lived with myeloma for many years, and it has got easier. At first, I couldn't commit myself to anything other than in the immediate future, book a holiday, for instance. However, I've always known that it's not always a nice way to go, and the experiences of those from the support group I'm in have gone on to confirm this. I try not to think about it, but one can't help it crossing one's mind from time to time. How would you recommend dealing with this?
If I understood the question right, and I apologize if I've not, it sounds like when they say that it's a nasty way to go, they're talking about the end of life.
I think so. Yeah.
Yeah. And again, I think it takes so much to even ask a question like that, because already by asking that question, you're confronting something that's very painful for us to confront. But I'm sure it'll be helpful to other people listening as well. You're right. It's inevitable that your mind will go there. It's much more difficult to stop thinking about something than to acknowledge the thoughts there, but that you don't have to try and answer the thought or the question right now. I think that can be one way of dealing with it. The other thing I'll say is to always remember that no matter how many people you hear from, you will not get the full picture. So I think it's helpful for people to have optimism and hope that with better and better palliative care, with better and better treatments that focus on quality of life as much as on kind of prolonging life, that when it comes to your time towards the end, I think it's important to have hope that your team will care for you in a way that makes it as comfortable as possible. But equally, it's absolutely fine for that thought to come into your mind, for you to remind yourself, I've heard a lot of negative stories, but I haven't heard every story. And I don't need to answer this question right now. Of course, if you are further along in your journey of myeloma and in the lines of treatment you've had, then it can also be helpful to ask your team what support can be offered at the end of life to make it not so nasty, to use the person's word.
Great, thank you. And I'll pass this one to you. This is from Patricia, who says, fatigue is a big problem in my life. Are there any ways I can improve my attitude to this? I do try to stay positive and don't give up easily.
So yeah, fatigue is a really common problem in myeloma patients, and something that we speak to people on the info line and the Ask the Nurse service about quite regularly. So staying positive is an excellent thing to do, but as Surabhi has mentioned, it's also it's healthy sometimes to appreciate that sometimes you have negative emotions about these things. It's completely natural, and not to completely squash those down. So some of the things that people can find helpful for sort of helping them to deal with fatigue is having a routine that's sustainable, and not sort of trying to push yourself too hard on good days, because that's potentially sort of stealing some of the energy from the next day and making it worse. Trying to keep up a diary to sort of keep up with patterns, things that maybe make you feel more tired or things that make you feel more energized, times when you feel better. Breaking down and planning tasks as well, into sort of sizable chunks that you can manage, and planning when you're going to do them. Maybe if you've worked out a time of day that's good for you, that sort of thing can be really helpful. And also just preparing for those bad days. Is there something you can do for a day in the future when maybe you're feeling very fatigued? Can you do some meal prepping? Can you make sure that things are ready to do a sort of nice thing for yourself as well? There's things like complementary therapies, including some of the relaxation things. So Surabhi's talked about relaxation techniques. They can be really helpful with fatigue as well as sort of emotional things as well. So that's a great thing to get involved with. And also trying to take some gentle exercise as well can help you sort of build up slowly to improving your fatigue as well.
Thank you. I hope that was helpful, Patricia, and anyone else who's dealing with fatigue. Sarabi, maybe we'll go back to you again. So again, this is just a really brave and honest thing to talk about. But since my stem cell transplant, my wife and children say I'm not the same person. I am less patient, and it's like a roulette as to which mindset I will be in each day. I need help to know if this is common and what I can do to improve my family's day-to-day life. I love my family so much and feel that their lives are being affected by my myeloma in such a negative way.
Yeah, thanks for that question. Couple of thoughts I'm having in response to that. One is, I think it can happen and we don't fully know. I think mood swings can be caused by a whole range of different things. They can be caused by purely psychological factors, but we know that things like steroids, for example, also contribute to mood swings, and there are certain drugs that might contribute to it. I think the answer actually lies in the question itself. The most meaningful part of that question and the most beautiful part of it was the person saying, I love my family so much, and I don't want this to have that impact. And this goes back to what I was saying earlier in my talk about values. Find the thing that's going to give you the motivation to be better than you are, and start from there. One thing you could do, it sounds like the person is feeling, but when they describe every day as a roulette, it sounds like they're feeling that the emotions are getting the top of them, and the emotion is dictating how they wake up. I would suggest that maybe take 5 minutes on the morning of each day when you wake up, before you talk to your family, to firstly try some breathing exercises, because that's proven to just anchor ourselves a little bit when we're feeling a little bit unsure. And then try and set a few intentions of how you are going to be today. So instead of the mood immediately dictating from the moment you wake up how you're going to react, instead of it being a roulette, try and bring a little bit of choice into it by thinking about that. I think the fact that you're aware of this is a really great thing, because actually many people react like this and are not aware. Your awareness of this is the best starting point. I would say build on that. Take 5 minutes every morning to just calm yourself, take a few deep breaths, and connect to an intention about what kind of qualities I'm going to show my family today. And that's a way to kind of get a little bit in the driver's seat. It might be that you have to share it with your mood, but at least it's not just the mood driving the car.
That's great. Thank you so much. The next question is, how do you accept changes in lifestyle and aspirations for the future along the myeloma journey? So I think this person's talking about as it changes. Is it natural to feel overwhelmed and selective about who you want to support you? Sarabi, do you want to start?
Yeah, I mean, I'll answer the second part of the question because it's easier to answer. Yes, I think you absolutely have the right to decide who you want to be by your side at different moments. And there might be different. I always say to people that one should have quite a diverse social support portfolio, because different people will have different skills. Some people will be very good at lifting you up. Some people will be very good at sitting with you when you just want somebody to sit with you in your low moments. So it's about going to the person who's going to give you what you need at any given moment. On the flip side, the one thing I will say is that be aware that you're not giving up on a good relationship in a moment of impulsivity or when you're feeling low and reactive. Because as I said in my talk, stress and anxiety can make us interpret a situation in a more negative way than we would if we were neutral. So I guess if you're asking yourself questions like, is there another way I could look at this? Or is there another way I could look at this relationship or this person? And then make a considered choice about who you want to support you with what type of need, because different people will be helpful at different times.
Great, thank you. This is a live question that's come in, so I don't know who wants to start, but the question is, what advice would you give to achieve the correct balance between physical and mental health?
Did you want to take that first, or?
Yeah, no, I'm happy to start.
Yeah.
So obviously it's a challenge, and it's going to be different for everyone, what you're prioritizing at what moment. Obviously both are incredibly important. Prioritizing one over the other can change, as I said, throughout your time. But it's also being aware that your physical health is going to affect your mental health, and your mental health will affect your physical health as well. So if you're sort of focusing one to the detriment of the other, then it's not going to be helpful in the long run. And I think that's something that people talk to us a lot about is in making treatment decisions is they're very worried about how they're going to feel on certain medications, the fear of side effects and things like that, alongside the potential benefits that they might have for treating the myeloma. And it is really definitely a very, very individual decision, and it's based on the moment. And I think it's sitting with yourself in the moment and seeing what's most important to you at that time is really important.
And yeah, I mean, there's very little I can add to that. And I fully agree with everything you said there, because the question made it seem like it's either or, but actually it's much more fluid than that. One feeds into the other. I guess the only thing I'll add is, there'll be times along the journey that you will have to compromise your mental health for the sake of your physical health, right? Because you have to put up with, say, maybe you won't be able to go to, I don't know, a friend's wedding because you're having a stem cell transplant, or maybe you won't be able to see your grandchildren because they're unwell and they have the flu, and so there will be things you will have to give up in favor of your physical health. And equally, there might be times when you do decide that your mental health takes priority, and you'll be willing to take some calculated risks for the sake of things that matter to you. So to just further your point, Em, it's about really recognizing that as long as you're making a considered choice, and when you're having to give something up for something else, it's about kind of having that sense of, why am I doing this? That can help us tolerate the costs of it a little bit better.
Thank you. And I'll pass this on to you. So is loss of strength for people with myeloma common? This has affected my well-being. Any suggestions into how to maintain strength over many years?
Yes, so loss of strength can be something that we see quite a lot in myeloma. It sort of comes along quite a lot with fatigue usually. It tends to be related to sort of the loss of strength and ability directly from myeloma and its treatments, and also just being less active, potentially because you are unwell with your myeloma or because of your treatments. And also sort of struggling with nutrition. So people who are on treatments that mean that they don't want to eat quite as much, feeling quite unwell with their treatments, that can impact your strength as well. So in terms of maintaining sort of strength, sort of gentle exercise is really helpful. Things like resistance exercises, obviously being very gentle, being aware of your limitations, especially if you have myeloma bone disease, it might be worth having a chat with your medical team before you start any new types of exercises or anything like that, and building up really, really slowly. And also making sure that you have a good balanced diet, are getting plenty of calories in, which I know can be a struggle with some medications. We do have sort of some advice on our website, and we've done a previous Infoday session about diet and things that can be really helpful for sort of making sure that you're having a good balanced diet and getting in enough food to keep up your strength.
Great, thank you. And another one for you, Em. So what happens after a patient has gone through all the nice recommended treatments? I know that there will probably be a variable period of relief, but what then apart from palliative care?
Okay, so looking at sort of a relapse following the last sort of line of NHS treatment, there are still some options for patients. It obviously depends on what treatment lines you've been through before and how unwell you are, how rapidly you're relapsing and things like that. Some options are clinical trials. There's often clinical trials that are recruiting. It's worth having a look on our clinical trial finder or speaking to your hematologist about any clinical trials that they think you might be appropriate for. There's individual funding requests is something you can speak to your hematologist about. So that's how you can get hold of medications that aren't necessarily available on the NHS, but have been approved for myeloma within the UK. They require an application just to get the treatment paid for, essentially. There's something called expanded access schemes as well, run by some drug companies who are doing clinical trials. These are for patients who it would be their last option. They can get access to treatments that would otherwise only be available in clinical trials. And then, as you said, sort of palliative care is another mainstay for people who are coming towards the end of their life, and it's very important in making sure that people are comfortable and they have sort of the best quality of life towards the end of their life.
Thank you. Yeah, I hope that's really helpful for the person that asked this. I think that's great advice. Thank you. So Abby, if we move back to you, so someone said, I find it difficult to stay motivated about my work when there is the ever-present side effects of maintenance treatment, hospital appointments, tiredness and pain, including concern of the myeloma returning, which of course you've discussed. How can I move forward and try to be positive with this clouding my thinking?
So in the question, the person has listed a variety of things that can have an impact on motivation and work. And some of them will cloud thinking, but some of them are actually real things that need to be factored in. So if they're having pain and if they're having fatigue and they're not able to work at 100%, it's important to be compassionate about that and have compassion for self about that and say, you know what, I didn't do as well today as I might have liked to, but I did my best. And actually, what can happen is we are our own worst critic. So often, your work colleagues or your manager isn't noticing all the things that you're noticing about your own performance at work and your motivation at work. And we can think that everybody can see it, but actually, people can't. And people are generally much more sympathetic than we give them credit for. So it's about on the days when you have to accommodate some very real challenges around pain, fatigue, etc., it's important to just do your best and not expect too much of yourself. On the days when it's uncertainty and questions like how long this journey has already been and kind of frustrations about that's what's clouding your thinking, then it's about, again, taking a breath, anchoring yourself and saying, is this related to my work in any way or not? Like, what's coming in that doesn't need to be here right now? It's there. I'm not going to try and push it away, but I'm just going to notice it and I'm going to say, that thought is there in my mind, but I'm going to try and focus as much as possible on what's in front of me right now. Again, that here and now focus and constantly coming back to that can stop our minds from hijacking our thoughts, because that's what's happening. And it's so easy for all of us to do it. It's the easiest thing for us to do, to get caught up in our thoughts and move away from whatever the activity is we're doing then and there.
Yeah, and I think so. This is the final question. Sorry, Em, is there anything that you wanted to add?
No, I think Sarabi covered that really well, to be honest.
Yeah, so I think this one's quite similar again, but just in case either of you have anything that you want to say, we'll just finish with this last question. So, although I'm in remission, I find it hard to live in the moment. Concerns about what might happen mean I find it hard to make plans for the future. Don't know if there's anything you want to add, Sarabi.
So it sounds like the person is kind of neither here nor there. They're finding it hard to live in the moment, but the uncertainty means they can't make plans for the future. I think it's about giving yourself, because what's happening is if you try to be too present and if you try looking too far ahead, there's problems. So try and give yourself a kind of mid-range perspective to look at when it comes to making plans for your life. Okay, I can't make plans for next year. Can I make plans for next month? And actually, you might find that you can make more plans than you're allowing for. And I hope this lands the right way for people. But what I often think about and say to people is, every plan we make, whether you have myeloma or not, every plan you've ever made is only ever an idea until you actually get to do it. So every plan you've ever made, you don't know whether you're going to be able to do it until the day actually comes. So it's absolutely okay within the context of living with myeloma that that's the case, that you make a plan on the understanding that you don't know whether you'll be able to follow through with it. But making plans is a very important part of feeling like we're living a normal life. So go ahead and make plans, realistic plans, with the understanding that, you know what, on the day, it's only the day that'll tell you whether you're able to go through with it or not. When it comes to being in the here and now, there are certain exercises that can help us develop that skill, because it is a skill. It's like a muscle that we can strengthen with practice. And that's what mindfulness exercises are. Now, mindfulness doesn't necessarily mean you have to sit in a meditation for 10 minutes or 20 minutes. There are different ways to practice mindfulness. If you're struggling to stay in the here and now, one simple technique that I like to utilize, because I'm not always the best at meditating, is go out into your garden or go to a park nearby, or just go somewhere where you can look outside and try and name 5 things you can see. Or even in the room you're sitting in now, name 5 things you can see, 4 things you can touch or feel, whether it's your cardigan, whether it's, the texture of your sofa, whether it's the feel of the dining table you're resting your hands on. Really try and use your senses. So 5 things you can see, 4 things you can touch, 3 things you can hear. Really pay attention and try and pick up on 3 sounds, whether it's the hum of the heater or the radiator or the microwave, the fridge. 2 things you can smell, 1 thing you can taste. This is a great exercise to force your senses to come into play and really make you live in the present moment. So these are some examples of mindfulness techniques that help us strengthen that skill.
That's great, thank you. And thank you. That's all the time we have for questions today, but thank you everyone who has submitted questions both live and before this. And I hope the answers have helped both those who've asked the question, but also everyone on this call today. So yeah, thank you for joining us. Please remember we are here to support you, and we offer so many services where you can speak to someone who understands. We have our myeloma info line and Ask the Nurse email service. Our information specialists, one of which is M, are available Monday to Friday, 9 AM to 5 PM. As well as the info packs and info sheets that have been mentioned in the chat, we also have a range of publications that you can download from our website, or you can order a selection of hard copies. And all of our previous digital Infoday sessions are up on our website and on our YouTube channel, where you can watch them on demand whenever you like. We have our peer buddy service, which provides the chance for patients and carers to tap into the knowledge and experience of others in a one-to-one setting and talk to someone who understands. We also have the Myeloma Discussion Forum, a place to get involved in conversations and ask questions to others who are living with myeloma or related conditions. And lastly, we have a range of support groups all over the UK where you can meet other patients, carers, and family members. And remember, although myeloma is a very individual cancer, you really don't have to go through it alone. There are lots of ways to connect with others who know what you are going through. So we've come to the end of our event today. Our thanks go to Em and Surabhi for speaking to us this evening with such great talks. We'd also like to thank everyone who has joined us tonight, and we hope you found it both helpful and informative. Just a reminder that you can now rewatch this event on our Facebook page, and it will be available on our website soon. And if we didn't get a chance to ask your question tonight, or if this event has prompted some new questions, please do contact us. You can do this via our info line or Ask the Nurse service. And the contact details are on the screen now, but they can also be found on our website too. And thanks to our supporters, Myeloma UK can provide these free digital events for patients and their families. So however you choose to support us, your generosity will help us to change the lives of people living with myeloma and their families. There is a link that is being posted in the chat to direct you to ways that you can donate. So once again, thank you for joining us, and I hope you enjoy the rest of your evening. Good night, everyone.